we've got some announcements to make today, but can I say that whilst there were 61,000 vaccination bookings made yesterday, a very strong number of bookings, that takes us to 400,000 bookings for the week, which is our strongest week to date. I can inform all of those listening and watching at home that there are 7,000 Pfizer first dose appointments that are empty, vacant, waiting for you at state clinics over the next week, and 11,000 first dose AstraZeneca appointments available at state clinics as well. So if you are minded to play your part to keep yourself safe, to keep your family safe, and indeed to help us in that race to 80% double dose, please go online, make one of those appointments, turn up. If it's an AstraZeneca appointment, then there'll be an experienced clinician to be able to talk you through what that means so you can make an informed choice. As the Chief Health Officer has said many, many times, and all of his deputies and all of us, because logic just tells you this, the best vaccine is the one that's available today. These vaccines have all been through a rigorous process. They're safe, they're effective. None of the people in hospital, no one that's gravely ill has been double dosed, and that's because these vaccines work. They are absolutely effective and safe. There's just a little process to go through in relation to AstraZeneca. I would commend that to anybody thinking about those things today. There are appointments available as we speak. Please go online, make one of those appointments, turn up, play your part, and that step, your actions, will take all of us closer to being out of lockdown, to being opened up, and to having our freedoms back. That's critically important. It also means less people in hospital, because it means less cases across our community. I can also just indicate, of those who are in hospital, there are 147 Victorians that are in hospital. 34 of those are in intensive care, and 28 of those are on a ventilator. Of the cases in hospital yesterday, only one was fully vaccinated, and I don't believe that's somebody who's on a ventilator. The key point here is that getting vaccinated works. It is incredibly effective against the transmission of this virus and against serious illness. There are appointments available. Please go and book one. To that end, we're very keen to take the vaccination program to local communities, to families. And that's why today we can announce a series of pop-ups at 100 priority postcodes where there are case numbers, postcodes where there are perhaps not enough people have been through the vaccination program. This will be done in stages. We can't open all of those pop-ups in one day, but there will be significant additional vaccination activity in those 100 postcodes. The first of those are 5 community-based pop-ups. They'll be in areas that need them most, so where the outbreak, where cases are and where cases are potentially growing, so in Hume, Dandenong and Casey. There will also be rolled into this a very significant effort to vaccinate our school kids, but not just school kids, but families as well. As you know, we've got a commitment to try and have all of our 12-year-old and up students, all of our secondary students and those grade 6s that are 12, to get them through the vaccination program by the end of the school year. There will be around 70 sites across our 70 schools across our public system where not only students but families, so parents, as well as teachers and staff will be able to go. This is all in addition to the 55 fixed sites that we have. These pop-ups are all about just removing another barrier, taking the vaccination program to you, as it were, so that you can come and be part of that, get your first and your second dose, play your part, get these lockdowns off, and of course protect yourself against becoming seriously ill. The first 8 of those 70 school sites will be in Dandenong, Point Cook, Werribee, Gladstone Park, Caroline Springs, Brunswick, and Tarneet, and we'll have more to say about the rollout of those additional pop-up state hubs. In addition to the 55 sites that we have, we've already expanded hours. We've got everything, including drive-through sites going. We've been innovative, we've been creative. It's why we've been able to get so many vaccinations done through our state hubs. It was estimated that we'd do about 25% of the work. We're running at more than 50% of the total work now. AstraZeneca doses, we're now, I think, over the 1 million double-dosed, 1 million Victorians that are double-dose protected via the AstraZeneca vaccine, and the lion's share of that's been done through state clinics. This is such an important part of the overall rollout, and we're delighted to play our part and indeed to do much more than we had perhaps planned on doing.